Welcome, everybody. We are here today with the Wonder Network, and our guest today is Dr. Dawn Ewing. Welcome, Dawn. Dr. Dawn, how are you?
I'm doing great.
Good. We're so happy to have you on the Wonder Network, and we're excited to have this topic. So I'm going to read a little bit about you, and then we'll get started. Dr. Dawn Ewing is a naturopath practitioner in Houston, Texas, executive director of the International Academy of Biological Dentistry and Medicine. Author of Let the Truth Be Known and featured on the movie Root Cause. So I'm really excited about this topic. I've actually had thermography done probably about 10 years ago, and I did it instead of a mammogram, I guess we would say. So let's talk a little bit about what is it? Explain to us what it is and how it works, and we'll get into more details. I'm super excited.
Okay. Well, thermography in itself is used in different things besides health. Thermography is used to image if cold or heat is coming in around a door or a window. It's used in the aircraft industry to see if there are leaks in different places or if a screw might be loose. So we do use thermography in just out in the world. Thermography itself is a camera that is a heat-seeking camera, and every pixel of a picture may be variants of different colors. So the idea is the hottest is white, and then it goes to a very dark red, then it goes more towards an orange, and then a yellow, and then a green, and then a blue, and then finally the very coldest is black. When we take an image of a person, let's say we're looking at their face, you might see different variants of colors. But if you had maybe a pimple and it was right between your eyebrows, the kind that puts a lot of pressure, yeah, that you feel like you really need to push, there's going to be a lot of inflammation there. And so in my camera, you would image with a white spot right there because it's hot and inflamed. There isn't a good color and a bad color. Matter of fact, when I take my very first image, I must find at least 1 pixel of white. I need to turn it down so that I have the smallest amount of white in the picture that I'm taking, which for me, the first picture is of the face. Somebody that doesn't recalibrate their camera, you could easily get missed images where you're fabricating things that aren't really there. But it's
so how does one, so someone like you who has the machine, they would know when to recalibrate it, so to speak, or reset it?
You must recalibrate it for every patient. Every patient is unique about where their warmest spot is. And we would love to see that reproducible. But if you come in with a sunburn or like I described, a pimple, then that's, you're not going to have that pimple next time. So hopefully that area is not going to be there. But usually it's pretty consistent. The advantage to doing thermography is we take our images, we try to take them the very same each time you come in, so that when we send them to EMI, which is electronic medical interpreters, and this is a really big thing that people need to know when they go get thermography, there is no requirement for someone to be certified. There used to be a person in my town, it was a guy that bought a camera and was taking pictures of women's breasts. He did send them to the appropriate place, but I mean, that's just creepy that, somebody is not a nurse or some kind of healthcare practitioner taking images. Yeah, he's no longer doing that, but there is certification. Most people get a camera, they go through the certification, and then they send their images to EMI. Now, if a physician bought a camera they could make a personal choice not to send the images to EMI, because that's the biggest cost of a person taking thermography pictures, is that they send those images to a physician that is trained through EMI. They keep the catalog the images and save them so that the next time they can overlay those images. And they actually use AI. The software goes in and says there's a temperature variance from last time in this area towards the warmer. And it pinpoints for the physician. Because I had an issue where I had an area that showed up on my left breast, and my thermography came back and said, hey, we see something that's warmer than it was last time. We'd like to get it reimaged in 3 months. So I did. And it came back, same thing, and said, it's still a little warmer than it was before. We suggest you go get an ultrasound, which I did without telling the ultrasound tech where anything was. And they pinpointed exactly where it was. And it wasn't anything. I didn't have to have it biopsied, but I sent that information back then to EMI, and they said, that's what we thought it was, but we always want to err on the side of caution. But it's looking at the picture, I couldn't see any difference. And so when I spoke to them, they said, you don't think we let the doctors use their eyes, do we? Actually have software that helps them determine this, because it's such a precision temperature that we don't want to depend on somebody's eyes and the difference in colors. But the reason that I got into this was I went for my annual mammogram about 15 years ago, and they imaged my right breast with no problem. They imaged my left breast, and the technician came out and said, I think you moved. Okay, I didn't think I moved, but okay. So they did it again. And she came back out and she said, no, it's still not good. I need to do it again. And I went, no, this is a lot of radiation. I'm not a fan of having it done again, but I particularly don't want you to do it again if you've done it twice and you haven't gotten it, because I'm not moving. So this is my story. So I'm going to tell you the way it is perceived in my mind. They brought in Helga. Helga handled my left breast and grabbed it and pushed it under and clamped it down. And I started crying because it really hurt much more than usual. And it's already an uncomfortable procedure. I'm not against mammogram, but for me, it was, I was in pain. When the image was over and they allowed the machine to release my breast, my arm went numb. And then I freaked and said, my left arm is completely numb. You sign a waiver that says that if anything happens, it's not their fault. So I had to go have an MRI done, and I had to pay for that. It pinched a nerve, and it did come back. But, it is radiation, and it's not without anything that can happen to you. It made me just start looking at what are my other options for myself. And I couldn't find any in town. Well, then to my delight, I found out more information about the teeth and how, any infections or anything going on with your head goes down the lymphatics to the breast. And I went, wow, I just found my way to do this in my office, because of course, most everything I do is dental and not really whole body. And so I got into thermography about 15 years ago. And it is very interesting to see how you can track different things. Even just having a baseline of a body. And I'm thinking of a particular woman because, I told you there is no good color or bad color. There's a warm color and there's a cool color. And you usually will show up consistent. There are some things that could throw you off. So this particular woman on the back, in between her shoulder blades, was always green and blue. And she came in and it was bright red. Now, she is a very, very dark complected individual. I know what a sunburn looks like on me. I look like a lobster, but I had no idea what a sunburn would look like on her. So that's my first question is, could you have a sunburn? She said, no. I said, okay, could somebody have slapped you, or did you come here with the heater on in your car on your seat? No. Okay. that is the terminal point for a gallbladder. So someone having gallbladder problems, that area would show up warmer, even though it has,
Okay.
that's not where the gallbladder is. The gallbladder is down here, but it's a
Yeah.
reflex point for it.
Okay.
Just like on your feet, and you have these reflex points when you have,
Reflexology. Yeah.
yes,
Mhm.
okay. So I asked her if when she ate greasy food, she was having indigestion. No. And I said, I'm asking you all these crazy questions because it looks like you were in a car accident. She said, oh, I was. In February, I was in a car accident, but they told me it's a pre-existing condition. I have this pain right here. And I said, no, that's right where I see it. And she said, well, that's funny because I had them do an MRI and they told me they can't find anything. So there's a place where I can type a note to the physician that's reading the report. And he went back, and she had about 8 years of thermographies with me. So he went back and looked at all those old thermographies, and he wrote in the report, no way, no how, not a pre-existing condition, never been here before. And she called me back to her delight and said, oh my gosh, they're paying for acupuncture, chiropractor, massage,
Oh,
anything I want right now, they're paying for. So it's good to just have
wow.
something in your back
Yeah.
pocket that says, this is the inflammation from my body at this point in time. It
Wow.
is very, very
Interesting.
good. When
Okay.
when I'm doing pictures, oftentimes I'll see that there's so much lighting up that I will ask the person, by chance, do you happen to know if you have a methylation issue, like an MTHFR flaw? And they'll look at, oh my gosh, how do you know about that? Because I see so much inflammation that, usually if a person starts taking a good kind of B12, like a methylated or hydroxy, and some folate, the next image is they're cooled down. And then I also know when they have stopped taking it, because I'll look at the images and go, last time you looked good and this time you don't look so good. Did you stop taking anything? Oh my gosh. It's like confessions here. Yes, I ran out.
I love that. Yeah, you're kind of like they're kind of telling on themselves a little bit. Do you, Dr. Dawn, do you do images of every dental patient you have before you
No,
work on them, or how does that
no,
work?
I have it set up completely separate. And so
Okay.
really people have to know that I do that and ask those people that come in. Occasionally a dentist will say the woman is complaining of maybe a lump in a breast and they want to know if there's any kind of a connection. And sometimes you can see that very clearly. It's not really the best technology to determine if there's a cavitation or if a root canal is a problem. I do different testing for that. But you can see, one of the best examples is if you take images of the breast, sometimes you can see blood vessels where they image just a
Mhm.
slightly different color. If a person is reactive to caffeine and they have fibrocystic breast tissue, they will light up like a Christmas tree. And so I'll point that out to
Okay.
them, and that you don't usually see cancer blam on both breasts. It'll start in one area, it starts to get a little larger and then even larger. Hopefully at the very, very sign of growth, we've already got them in somebody else's hands. But there are many times where someone comes in and my question to them is, did you just start female hormones or are you using caffeine? And so then I will offer a free come back, stop the caffeine for 30 days. You're going to have a raging headache, but let's get past that. And then come in and let me show you the difference. I had a lady that came in one time that was LDS, and the Mormon
Mhm.
faith really coaches them that caffeine is a drug
Yeah.
and it
Yeah.
affects your temper. And that particular individual was always, all the colors in her breast were always cool and calm. She never had any lymphatic congestion. But this time she came in and we'd had a conversation about her faith before. So I was very aware that she was LDS. And when I took the images, I said, who started you on female hormones? No, I don't take any female hormones. So I went through a list of things that somebody could get into, Dong Quai, wild yam, where they would take things on their own, but not be prescribed. No, I'm not taking any of those. So my next question was, I know you don't use caffeine, but there are other things that people might not be aware, like guarana, that is just like caffeine. No, I'm not doing any of those. Finally, I hit green tea. And she said, wait a minute, green tea doesn't have caffeine. It's supposed to be really good for your immune system. I said, no, it has boatloads of caffeine, actually more than coffee. Oh, no.
Yeah.
So she asked for her images, her before and after, before being cool and after being now that she had consumed caffeine. And she gave a talk in her church saying, you know, caffeine is a drug.
Yeah.
It's so out there and so accepted that nobody really thinks of it as a drug. But if you have fibrocystic tissue, it will create these little knots, which are not healthy. I had her
Interesting.
come back in 30 days and her picture was just like it was without the caffeine before. Everything was gone, no little knots in there. So it is a very good tool for educating somebody about how your body responds to certain things. You know, you eat a food that you're allergic to, and you might not think you're having an allergy because your eyes don't swell up, your lips don't swell up, your airway doesn't close. But when you see that gut and it's all inflamed, I mean, how are you going to, your body's not lying to you.
That's true. I'm one of those people who is sensitive to caffeine, and I started drinking coffee probably 7 years ago. I only because I moved from California to the Pacific Northwest where it was cold. I'm like, I'm just so cold. And I am sensitive to it. So I'm probably one of those people that it would show that if I did another one. And I do need to do another one. Um, okay. So you do it for dental, breast, or one or the other when you
No,
do.
I don't really use it for dental. I,
Okay.
I will do an upper body breast or I will
Okay.
do a full body. And
Okay.
a full body gives a lot of information about things that you would not even think about. Whether you have poor circulation to your feet and toes, might not be that you actually have poor circulation. It could be that you have an enos snip, and when you eat greens, you can't make nitric oxide, therefore your blood vessels can't dilate. Um, I don't want to slam mammography. I think that the biggest misconception is when you ask a woman, why are you having a mammogram? Oh, I want to
Mhm.
find out if I have breast cancer. Okay, well, the mammogram is not going to tell you if you have breast cancer. What? What do you mean? Of course it is. No, it's not. It's a screening tool. Tells you if there's something that wasn't there last year. But all it can capture is the part of the breast that you can get under the plate. Large
It's
breasted
true.
women have breast tissue under their armpit, and really large breasted women that are obese have breast tissue on their back, which is why I take pictures of the back. But I can capture under the armpit. So I can look at the congestion of lymph nodes, whether a woman is wearing a bra that's too tight, that's not allowing the body to detoxify like it's supposed to. Women are conditioned that we have to wear a bra. You
Mhm.
don't have to wear a bra. You can look at alternatives like I try
Mhm.
to. There's a great book called Dressed to Kill, and it is about the statistical data of women that do not wear bras versus those that do wear bras. It's interesting because some young women will come in and I'll say, not only are your lymphatics congested, but you have a line where your bra is digging into you. And it's usually a younger woman. Yeah, I wear a bra 24 hours a day except for when I shower. Why? Well, it matches my panties. Okay, that's just the dumbest reason ever. The only time I've ever said I understand was a woman that was about maybe 350 pounds. And I was trying to explain to her, I mean, it was digging into her. She needed to get a bigger size or an expander in the back. And she said, I have to sleep with it. And I kind of looked at her and went, why? Because these things will strangle me in my sleep if I don't. And honestly, if you saw them, they were sitting on her knees. That's how large she was. So in order to get all the images, I'd have to have her use two hands to hold one up and kind of pull it up over her shoulder to be able to get the underside. Most women are not that large.
Yeah.
But, there's breast tissue other places than just where you think breast tissue should be. So the thermography is able to capture all those. It is a great tool. I wish, because it's doesn't use any ionizing radiation, I wish that it was more accepted and would be the first line. And if we saw something, then we would go for a mammogram, then we would go for an ultrasound, and then we would move on from there. But and in some countries, it is very, very accepted. Some of the countries that have nationalized or socialized medicine, it's less expensive, and it's a good screening tool to find things that are hot spots or cold spots. I mean, I'm not going to say the hot spot is always a bad thing. If I take your images of your hands and your fingers don't show up, that's a problem. And they're not hot, they're too cold.
Oh, okay. And I know a lot of people that have that situation. Does typical insurance pay for this service?
Not in the United States, it doesn't. Your insurance that you take out, it's not really insurance. You have a payment plan that you can put into a wellness and use your plan for that. It will cover it. Yeah, that's what you use for your eyeglasses and other things that your typical insurance won't pay for.
And that could explain a lot why people aren't using it more regularly, because I love it. I haven't done a mammogram since I did thermography, and that was a long time ago. I probably should do another one. Not mammogram, but another thermography. So that explains why a lot of people may not be aware of it. And unless they're coming out of their pocket to pay for it, most insurances probably won't cover it, it sounds like. So
right. And depending on where you are in the country, the price varies. I offer 13 images for $215, which is not terrible. Most places, just doing breast is that, just breast, and they offer 5 images that I take pictures of the head, the neck, the back, because all of that is connected to the lymph. And so if I'm just looking at breast, I want to look at everything that is connected to breast. Most people will come in annually. Occasionally, I will have someone who has found out they have breast cancer. They are choosing not to go conventional route, and they are monitoring things on their own, and they'll come in every 3 months because they want to make sure that it's going in the correct direction and that they're not being stupid.
That's smart. That's very smart. Yeah. Or people can use their health savings account and things like that if they want to, for things like that. Let me ask you this. Is it equally or partially as good for men to use thermography?
Oh, I have a good number of men that come through. Men are not, immune to breast cancer, especially if it runs in their family. And I think the most interesting thing about men is I'm going to say probably 90% of men that I image have gynecomastia, which means that they have breast tissue, actual breast tissue. And a lot of that is because we've been using so many plastics and estrogen mimicking things that they have developed higher levels of estrogen. And I don't know what the statistics are prior to probably 1960, because I wasn't doing thermography then. But a huge number of men come in and they have man boobs. And I try to explain what that is to them. And then, oh, yeah, I do. Yeah, look at most men.
And they don't. And well, I know men who are actually they're embarrassed. They don't know how to get rid of it, but they also don't necessarily know how they got it. And I agree with you. It's the plastic, it's the microwave, it's the soy, all the things that are creating this a lot of estrogen, more than men really need. And then it's also affecting their masculinity.
Oh yeah.
Right. So there, I mean, I've done shows on that whole thing and probably will do more, because I think a lot of men don't realize what's contributing to that. So you recommend it for men as well?
Oh yes. And I don't push a full body, but there's an incredible amount of information, and it's just good to have in your bank in case something happens later. You injure a knee. Now they can compare what your knee was when it wasn't injured to what it is now. You can monitor it to see if the therapy is working, to see if the inflammation is going down.
To heal, to recover from illness or trauma, to regain health and recuperate the physical, mental, and emotional body. But how? How do we truly do that? Bring on the healing vibrations of essential oils. Born of life-giving essence, the plants that surround us are captured in time by extracting some of the highest healing compounds known to humankind. From ancient civilizations and spiritual elders to sacred shamans and medicine men to midwives and even surgeons, our ancestors used these precious oils as medicine. Embracing the natural world, we recognize the importance of this long-lost plant-based pharmacy and invite you to be inspired by the magical medicine they provide. Awaken to the healing power within you and start your wellness journey today.
It doesn't replace some things. Like somebody will come in and say, my doctor told me I needed to do a colonoscopy and I don't want to do that, so I'm going to do this. No, I'll cut you off right there. That's what you're doing it for. Yeah. It doesn't replace that, so I'm sorry. Or my doctor told me I need to do a PET scan of my entire body because I've got cancer that's metastasized somewhere and I don't really want to do the PET scan. No, sorry, got nothing for you. The PET scan is far superior, far more diagnostic. This is really when somebody doesn't know what's going on, and it will come back with an incredible amount of information. Some people don't realize they're clenching or grinding. I take, regardless of whether you're doing full body or just upper body breast, I take pictures from the side. So when you're looking at this side picture, the back of the head should line up with the spine. So I tell people, sit up straight for me. Most people are sitting like this, and I'm looking at them going,
guilty.
Okay,
yeah,
that's as straight as you can be. That's either an airway issue or they have a, kyphus, they have a dowager hump on their back and their spine is crooked. Then you see a chiropractor or get some Rolfing done to see if they can structurally start to sit up. But if I can catch that in a really young person and point that out to them, there are devices that you can wear that will help you sit up straighter. There's no advantage, and especially with computers nowadays, we sit up all hunched over. And I try to
slouch, we hold on,
yes.
we're in the same position, or we'll lay in bed and our, not move our neck for hours. We're just like different, I'm guilty of that. So I have to be really aware.
Get trained to that. And I can show them that. And I say, you're going to be the person in a nursing home that is walking, looking down, trying to look at your friends from the side because you cannot stand up straight.
Yep. I can actually feel it in my neck. Yeah, I can actually feel it when I've done it too much. I can actually feel the strain here, in my neck where I'm just like, I'm too hunched over, or I'm sitting here too long doing exactly what you're talking about. So and I'm just a natural sloucher. Like I'm not a great, like stand up straight kind of person. So I think that's, you're kind of calling me out. But
in thermography, I tell people, we divide you into a right and a left. And most things you have two of, 2 eyes, 2 ears, 2 breasts, 2 lungs. There are certain things that you only have one of. You only have 1 liver, you only have 1 heart, you only have 1 spleen. So we are very aware that there should be symmetry or look the same on both sides till you hit a certain point. So if I'm doing full body and all of a sudden I see a really cold spot on the left side or on the back of the left, it's a marker for cardiac dysfunction. That part is pumping 24 hours a day. There should be friction. It should be warmer, not colder. So there are some flags of things that the physician will type back. It's not like they diagnose something. They will say, need to rule out this, need to rule out that, need to get further testing done. It comes back with a lot of information, though, a lot, especially when you're looking at like joints. You have multiple joints that are lighting up with inflammation, and it helps direct you about, where do I go? Do I go to a chiropractor? Should I take this to my MD? Do I go look for an allergist? Do I take this to the dentist? And sometimes it's broken up and several of those images are going to go different places.
And sometimes it's a matter of maybe just changing your diet.
Yes.
You know, it causes inflammation. I have to tell you, when I did my thermography, like I said, it was probably about 10 years ago. I don't feel like the person that did mine kind of explained in detail what you just did. So if somebody doesn't understand thermography or have never had it done, what questions would they ask a practitioner to make sure? Because you just said so many things that my thermography person never mentioned, and the connections to different places. What questions could they ask? Because nobody wants to be with that one guy who bought the camera and was just doing breast images. Like, you want somebody with some health history,
first off,
right?
You have to understand that the person doing the imaging, for the most part, I'm going to say at least 60%, cannot tell you anything because they don't have a medical license to tell you. So it's like going to get an ultrasound of your gallbladder and her eyes about pop out because she sees that you're pregnant. And you didn't even know you were pregnant, but she can't tell you that because she's got to send that information off to somebody else. So
fair enough.
Don't expect that thermographer is going to do that. I have a huge sign in my office that says, I'm taking the images. I am not your doctor. These need to go to your primary care doctor. I don't want them to try to treat themselves.
Okay, fair enough. I like that.
The pictures get sent to a physician. That the EMI only employs MDs that are licensed. Most of them are either radiologists, oncologists, or OBGYN, because that's just the kind of physician that is attracted to this technology. They type a report that is from them, a physician, to another physician. So it's all in medical words. So the average person, when they get it back, just looks at it and goes, yeah, I don't understand any of that. Fortunately, they put 2 green bars if both breasts look good, yellow, orange, or red if there's anything that is of concern. I always tell my patients, yes, this is what you're supposed to do. You're supposed to, take it to somebody. If you're really concerned about something, highlight the part that you're concerned about, that you don't understand the terminology. Email it to me and I will email you back what that means in English.
So that in layman's terms, so we don't have to understand doctor lingo, because it can get really confusing for people like us who are just like, I don't know, I just saw a bunch of different colors and maybe I have pain or inflammation, but they don't really understand the lingo. So that's lovely. Where would they email that to you if they did have a question?
Well, they can email it to me, Dr. Dawn at drdawn.net, but they need to be very specific about what, go ahead and highlight the part of the report that they don't understand, and then let me take a look at it and I'll email them back and say, this is what it means.
Okay, I love that you do that. I really do. So in your area, are you taking new patients for this service?
For thermography, yes.
Okay.
But do realize that I'm trying to find a way to semi-retire. So I'm not really putting a plug out there for myself. I think the technology is amazing. I want people to find someone who is certified. That's non-negotiable for me. And I always tell my patients, if you move and you're looking for another thermography place to go, make sure they send your images to EMI, because to me, it's a crime if you've been seeing somebody and you have 10 years of imaging there, and then you move to Hawaii and you find out that they never sent the images to EMI. They just typed an in-house report for you about what their physician saw on there. They didn't use any software because the software is not available to anybody other than the physicians that work with EMI. And now you don't have a way to compare the image from 10 years ago to the image now. You're virtually starting over. So I would caution people,
Oh, that's
ask,
awful. Okay.
where are your images? Who reads your images? Where are they sent? You want to hear EMI, which is, again, is electronic.
Okay. So you want certification, you want EMI. Is there anything else that they would have that you would suggest to them?
I would ask them to look at their very first image that was taken for their whatever study they were doing. If it was, head and neck, then look at that very first image. It should not have a lot of white. If it has a lot of white, the camera was set too high, and you're going to be fabricating things that are not really there. So you've got to turn it down. But there must be at least 1 pixel of white. If, again, they've turned it down too low, then the person doesn't understand what they need to do in order to get very clear, concise, repeatable images.
Okay. I love that. I love that. Okay. Well, thank you, Dr. Dawn. That's great information. Is there anything else you'd like to suggest for somebody getting thermography done, men or women, children? And is it used on pets at all, or children in any way?
Oh, that's such a good question. I love like doing little research projects. So we have a vet in our area who is interested in getting into thermography. And I took apart my camera. I went out to her place. She works with rescue horses. And I was standing on a ladder trying to hold my camera. My dad is down below with the computer, and I'm telling him, hit the button, hit the button. And so he hits the button and an image shows up on the computer. And then the vet used a laser up and down the back, because on this particular horse, there was a red line going down the back. And I have all these images. They're so cool. I kept them through the years. We did some dogs. We did this probably 6 different horses. But this one horse, this red line, she's using the laser just for maybe 5 or 6 passes. And then she said, okay, go ahead and re-image it. And my dad looked at me and said, what's she doing? Is that like the scanner device they use at the grocery store to look for the scanned barcode? And I said, well, not exactly, but it does use part of that technology. Just hit the button. And when he hit the button, it was no longer red. Now, the horse doesn't have any kind of placebo effect. It's not like we're telling the horse, we're trying to fix you here, and then the horse can change colors. That was pretty powerful to see that this horse, who had a lot of inflammation along its spine, could be improved by just simply using this red light on it. Is amazing. We did that over and over.
So red light therapy basically is what she was doing to heal it instantaneously.
And they do use thermography and equine therapy a lot, because if you're going to be racing a horse, you don't want inflammation. You really want to know that your chances are good. So there's big bucks in equine therapy and thermography.
Yeah, I love that. Okay. And so any children use it for anything, or they use it for anything like that you're aware of?
They do use it on children. I screened a neighborhood child where we were concerned that he might have broken his leg. And thermography can show you that there's an incredible amount. I mean, it'll just be white if there's a fracture, because there's a ton of blood escaping. And it wasn't. There was a little bit of red. And so I said, this particular family didn't have a lot of money to be able to go sit in an ER and take on those expenses. But that's not really how it should be used in a normal setting. But it can be used for a lot of things, like wound healing and just documenting diabetics and whether they're getting better circulation to their feet. When I talked about the enos earlier, on myself, I did this when I was doing a thermography presentation. I have Raynaud's, for those of you that don't know what that is, it's an autoimmune where your body gets confused during times of any kind of stress. The stress could be cold weather. The stress could be somebody yelled at me. The stress could be think I'm late for something, and your body tries to conserve blood to the torso where those important organs are. And it doesn't think your fingers and toes are so important. So sometimes your fingers will absolutely turn white. I mean, you're looking at them going, oh my gosh, that's crazy. And they hurt and they tingle. And so you're sitting there going like this because you're trying to get circulation to come back. I found out I had an enos SNP, which has to do with I drink a green drink and my body just doesn't use it appropriately. So there's a supplement that you can use. And so for fun, I took pictures of my hands and my fingers didn't show up at all. Looks like somebody just cut them off. You can see my
That's weird. That would be
hands,
scary.
Yeah.
Yeah.
And then I popped this supplement and let it dissolve in my mouth. And then about 15 minutes later, I took pictures and my fingers were there. It just makes the blood
Interesting.
vessels dilate and forces blood to get to areas that it couldn't get to before. It's very good for lowering blood pressure for people. So it has some other uses, but I was just trying to document a change based on something that was not just, oh, I feel like my fingers feel better. I mean, actually being able to take me out of the link and say, no, there's actually better circulation there.
That's so lovely. Do you want to talk about that supplement or the name of it? Because I know people are going to ask me. So.
It's anything that increases your nitric oxide. So there's several different companies out there. Another time I did just for fun, I had someone that does fascia release. And we took a subject and I took pictures of their back. And yes, there were some areas that showed up with white and red on the back. Now that would feel like little knots. If you've had a massage where somebody is working on something, you're going, yeah, you can stop on that area because it hurts. They'll get it to a point where it almost just pops and dissipates, and then they'll move on to another area. Well, what happened was everything cleared up, but it moved to a completely different area and it was hot white. And had we not done the second image, we would know, oh, she's not done yet. And so then he went back, got her back on the table, worked on that area, and then we re-imaged again and it was good.
I've had that kind of work, fascia release. I love it, by the way, because they really get into places and kind of like they almost stretch you in ways that you've never considered you even had muscles or things there that could be. Crazy. So it's great work. I do love that. I just got a massage because I'm that person with all the back stuff.
Connected. So you don't realize that this tight shoulder that's up here is affecting your hip on the other side. And it just doesn't make logical sense. Another time I had a gentleman that came in and he told me that he was going to make an investment in something, but he was curious about what I thought about it. And when he explained it to me, I went, well, you know what? Let's just test it out. It's a little gadget. If I took my phone case off, you'd be able to see there's a little square there. But it is a hologram on a sticker.
Hologram. Yep.
So this guy was going to make an investment because it's supposed to help with the EMF on your phone. And I went, I don't know about that. So what I had him do was talk on the phone. Well, I took a picture of him from the side before anything started. I had him talk on the phone and I'm holding that phone on his face and talked on the phone. And then I took pictures. It was awful. I had no idea how warm a phone was and what it does to your face, but it's almost like it just cooked it.
Yeah.
And
your ear. I've had that where my ear gets really warm or my face. And I'm like, I've been on the phone too long. Yeah.
Then I waited for it to cool down and saw how long it took to cool down. And then we waited until his picture that I took looked just like the very, very first picture I took. And then we put a sticker on the phone and we made him repeat the whole thing over again. And I am mushing that phone on his face and we took it off. It was about a third as warm.
Really?
And it only took like 2 minutes for it to completely go back to the norm. And I just looked at me, what is that? But those images
People have asked me if that product's effective. Yeah.
And all I can speak about is this one. I have no idea. I understand the concept of trying to reduce the chaos of all of that EMF. I understand EMF because when I worked on an ambulance, if somebody coded, which means their heart stopped, and they were in their kitchen, and you're putting EKG pads on them, and just so happens that the refrigerator cycles on. You know, the refrigerator's on the whole time, but the fan comes on every once in a while, and you hear it. That creates an incredible amount of electromagnetic field. And I can't see an EKG. It's 60 cycle interference. So I'd have to get the fireman to drag the person into another part of the house so that I could even see what the EKG is. So my understanding now is you don't want to sleep on the backside of a refrigerator or beside a refrigerator or above a refrigerator because EMF goes in different directions. And that was a really incredible use of the camera to try to think outside of the box and document that something's working. Because I've seen a lot of people muscle test for gadgets and say, oh, yes, this is better. The conventional side of me says I need something more conventional that I can see, that's tactile, that I can feel to validate what somebody is saying, because I'm always the skeptic.
No, that's good. I think it's great because people have asked me, do those things work? And I said, I don't know. I mean, it can't hurt. I don't think it's going to hurt, but I don't know. So I'm glad that you mentioned that because I keep things near my phone or in my phone or things just to block as much as I can from EMF. So that's really good. I love that. So thank you. I love this. Any final words you want to recommend to anybody looking to do thermography or anything, any other things that can help people with?
Just follow follow your heart, do your due diligence. Don't believe everything that somebody says. The thermography can be a valuable tool with very little, it doesn't have any radiation, but it doesn't touch you. I don't look at the people as they're undressed because I'm looking at, there's a black and white field that I can look at. So I'm directing them about how they need to sit or which way they need to turn without actually looking at them. So yesterday I had a lady that said, I'm so sorry. I'm so sorry. I was stupid when I was young. I have tattoos all over. And I said, I can't see them. Tattoos don't show up in thermography. I would never know you had tattoos had you not said that. And I'm not going to turn and look at you. So I'm focused looking at my little screen here. Yeah, people should look into it, but make sure that you've got somebody that's credible. With any technology, there's people out there who aren't, they don't have their heart in the right place.
I would agree with that. Certification is important, and obviously experience and some kind of healing or medical background is always good. So I appreciate that. I really am glad we did this show. I've been wanting to do it forever. So thank you, Dr. Dawn. You're always such a pleasure to have on, and you're such a wealth of knowledge. So we appreciate you more than you know. And thank you for coming back to Wonder with us and the Wonder Network. So we're excited to have you, and I'm sure we'll have you back again for other topics. But this was a great one. Thank you so much. And we will see you soon. Thank you, Dr. Dawn.
Mm-hmm.
Okay.